Hi everyone, we're live at Gerocare's 5th anniversary. Gerocare is a subscription-based service that offers medical care and support to the elderly in our society. Here we're going to interview major stakeholders and guests.
We don't know where we're coming from if we don't connect with the elderly, and so we need to take care of them. I'm so happy to be part of this initiative.
Good morning, sir. Good morning. Please, can you kindly introduce yourself and tell us who you are?
Okay. I'm Dr. Ajibola Miraibu. I'm the co-founder and COO of Gerocare.
Thank you, sir. Gerocare is an amazing initiative. Can you please tell us the rationale behind it?
Yeah, so looking at the health system in Nigeria, it was necessary to come up with something that will help the seniors. So my partners and I, of course, we've had personal incidences like my partner having his dad have 2 strokes in the space of 2 months. And that wasn't that he couldn't have helped. He's a medical doctor, but because he couldn't be there, because he has to go to other places to fend for his own family. So this is the situation with most of us. We have to go out somewhere else to work, but the care our parents gave us when we were young, we should reciprocate it no matter where we are. So Gerocare makes it easy for the individuals, even government, anybody to take care of the elderly ones, no matter where they are within Nigeria and, of course, Africa.
My name is Dr. A.B. Alfrey, co-founder and CEO of Gerocare. So in coming years, we need to understand as a country that the solution is available. Most of the times, the people we speak to have the problem we're solving, which is providing care for their parents, but they have no idea we exist. Fortunately, now more people are hearing about us and telling others about it. So in the future, we expect that almost every single person that can afford the care will provide care for their parents and not allow them have conditions before they take the steps necessary.
I encountered Gerocare through a Lagos Innovate program, which is run under the LSCTF, Lagos State Employment Trust Fund. They benefited from the Lagos Innovate program and have since actually given back to us. So we have Dr. Offrey as one of our mentors for anything that has to do with health tech, and he's also a facilitator on the same thing. So we're glad to have him and we're glad to be here.
Sean, like 3 things you like about elderly people.
Elderly people listen. So like I mentioned before, I have parents, my mom and my dad will listen to you. We young people, we're always on the fast lane. We don't really listen. That's one. Number 2, they are fragile. So you might not know that they are emotional because they won't show it. They try to keep it, but they are really fragile. And number 3, I think they are just nice.
One of the partners of Gerocare. Can you tell us why you chose to partner with Gerocare?
Yeah, because we are interested in impact and, of course, the innovation that Gerocare is bringing on board. And as part of their mission is to provide access to healthcare to the underserved people. And, of course, my medicines, we are really interested in that impact.
People. I love being around them because they are caring, they are loving. There are so many things, you know.
All right, awesome. So what would you like to say to Gerocare as they turn 5?
Well, I'll just say happy birthday to Gerocare. You know, it's a wonderful 5-year anniversary, and I hope to see 10 years, 15 years, and more to come.
All right.
A privileged organization to be entrusted with the responsibility of taking care of these elderly ones on behalf of their kids who are far away trying to make a living for themselves. So for us, we take that responsibility very seriously, and we will take each and every elderly entrusted in our care as our own parents. And as a result, we never want to see them have a problem. We don't want to see them have health challenges because, I mean, what we wish for ourselves is what we wish for our clients.
Has been working for the brand.
Has been exciting. Well, there have been some lows here and there, but it has been exciting because I love what I do. I'm a medical doctor by profession, so I love saving lives. I love ensuring that lives are not just, we don't just attend to emergency situations, we help to prolong lives. So we try and do more of preventive medicine. So when the doctor goes there regularly and checks their vitals and all of that to make sure that, okay, these people are constantly in a healthy state and then they have longer lives. So I enjoy being part of that process of making them live longer and enjoy their elderly age. Yes.
Awesome. What do you like about the Gerocare brand?
Okay, you know, like 10 years ago, my dad has a kind of crisis, health crisis, and he's staying in Osun State. And I know what I went through there before we now, you know, contacted an hospital to start taking care of him. If I have known that something like this was on ground, man, this is the best thing that comes to our elderly people. Our parents are neglected, you know, especially when after retirement, most of them go back to the village and they are neglected. But if you have something like this, of course, I mean, our mind will be at rest that, okay, you know, somebody is, you know, taking care of your parents somewhere.
How's it been working with the brand?
It's a delight because they're solving a very major problem, you know. Geriatric medicine has always been a big deal for people that have older parents because most times HMOs are not willing to take care of them. And with them, you are sure that your parents or elderly ones, uncles are well taken care of wherever you are. You don't have to run around during emergencies. They are there. And if they are well taken care of health-wise, then you are comfortable that, you know, they feel good about themselves, yes.
Congratulations to the Gerocare brand. Thank you so much for watching. My name is Monique and this is Narrative.